Hello, I am Dr. Randall. Welcome back to Core IQ, where we talk about the skills we all need in life and in business. Skills like negotiation, goal setting, time management. And we're here with JC Cavitt. Welcome.
Thank you for having me, Dr. Bill.
Absolutely. And we're here to talk about a really important topic, trauma, the shared trauma cycle. You've put this graphic together. Why don't we start off with explaining who you are, and I'll mention you might want to print off the graphic from the website as we kind of follow along. So if you would.
Absolutely. So I'm JC Cavitt, and I'm a sociologist. I'm also going to grad school now for social work, and I've been working with kids for about the past 15 years.
Okay, so I bet with that comes some experience with trauma and dealing with
absolutely.
This stuff. Okay.
Absolutely.
Okay, so why don't we start off with the topic, shared trauma cycle. What's the big picture of this topic, and why is it important?
Well, I think everybody to some degree experience trauma. And in its simplest form, trauma is something that impacts you that can have lingering effects.
Right. Yeah, and I've heard it said, like when I was dealing with the battered women discussion, if someone's hit, that's horrible. It's absolutely unacceptable. But that bruise will heal in about 2 weeks. But the emotional trauma is what's really damaging.
Absolutely.
It can last for years.
Absolutely.
Okay. So trauma is a bad thing. And I see here in the big picture, you got the victim and the bully. How does that tie in with the title? What's the big picture?
So like I said earlier, I work with kids, and the kids that I work with, many of them have been on the receiving end of being bullied, but I've also worked with the bullies themselves.
Okay.
And one of the things that I've learned in working with both groups is that they both experience trauma.
Okay. So they have something in common.
Absolutely. If you stay on the dotted line, you're going to stay in this cycle of trauma.
Okay.
And so the solid lines these are opportunities, these are escape routes so that you can break this cycle.
Okay, I totally get that. So do you want to start with the victim cycle and kind of work through this?
Yeah, sure. So with the victim cycle, for those kids who are getting bullied, they experience the trauma.
Okay.
And no fault of their own. Some of the kids that I work with feel like they deserve being bullied, or they think that it's something that they've done or said that merits that being victimized, and it's not. So it starts with the trauma itself.
Okay.
All right.
Okay. Now, you said something really that triggered me, because victims are never responsible. And anybody that suggests anything is nonsense.
Never responsible.
Okay, gotcha. So they experience the trauma. What do you do to break out of that?
So one of the things that I always advise is trying to find someone that you could talk to. And in my situation, sometimes advising my kids to talk to a teacher or a principal or a guidance counselor, that doesn't always work. So we have to be creative about who kids talk to now, because they don't want to be viewed as a snitch.
Right. Okay. Yeah, I got you. So to break out, I see the cycle goes here if you don't do anything, and then you break out by talking about it, and then you find someone you can trust, essentially. Yeah. And then what kind of choices? Where does it go from there?
So if we don't take that exit strategy, the trauma brings about all of these feelings. So that if a person don't look for an avenue to resolve or to deal with the trauma, it leads to these feelings that oftentimes are negative, they're self-defeating, they're internal, and it starts us on this path of negative self-thinking.
Okay.
Then these feelings come in, and you having to navigate through those feelings. Now I'm afraid to go to school, or I'm trying to avoid school because I don't want to be victimized any longer.
Okay, got it. So what's kind of the next step in the cycle?
So the next step in the cycle is that I still have to try, no matter what. I always encourage someone, try to identify someone that you could go to. With kids, a lot of times they're in situations that are way bigger than them, and it needs some outside help. So this is when you stay on the cycle, you have to start tracking your body signals, become aware of what is getting activated and triggered in you when you start to experience this negative self-talk. So it's things like sweaty palms, butterflies in your stomach, heart start to race. They start having body sensations. A lot of them start turning to negative harm, so they self-inflict harm. Some of them drop out of school, and they try to solve the problem by avoiding the problem.
Okay, and we don't solve problems by avoiding them.
Using that as a strategy, the trauma still remains.
Okay.
You're not fixing anything by running away from it. If you don't get off of this cycle, it impacts you. This unresolved trauma shows up in other areas of your life. So we have to find creative solutions.
Okay, got it. So what's kind of next on the cycle?
So if you've done all of these things, and now one of the ways to kind of help combat that negative self-talk is identifying healthy strategies to impact some of the negative self-talk and the negative emotions. And one of the best things that you could do is exercise. Do things that make you feel good about who you are. I tell a lot of my kids, a lot of them are really talented songwriters and dancers and athletes. Like, feed energy into the things that make you you.
Yeah, yeah. Well, you mentioned exercise, a huge thing. I mean, I think I've told you, when we were out to lunch or something, I've gotten into exercise in the last 6 months. Game changer, game changer. Okay, because that really, not only it takes care of yourself physically, but emotionally.
Yeah, and it's proven that it releases certain chemicals in the body that makes you feel good. It gives you the natural high. The next thing is, if you stay on this cycle, you open up the door for other people to bully you, or you become this doormat that people walk on when you don't stand up for yourself and get the help that you need. And you have to ask yourself a question at this point is, am I going to allow this what's happening to me, the effects of this trauma, to hinder me from moving forward in my life?
Okay. And I'm seeing kind of a pattern about talking about it. And that's the mistake people make that keep them trapped in this cycle, is they keep it inside.
Absolutely.
Okay, cool. So what's next?
Then finally, if it gets to the point and if you need it, absolutely seek out professional help. Sometimes that professional help may be law enforcement, it may be mental health, it may be therapy, it may be self-defense classes. You know, so whatever that is, that whatever help that you need to kind of resolve this violent situation or this victimized situation, get the help that you need.
That's a sign of strength.
Absolutely.
Sometimes people think calling the police, calling a therapist, calling someone and reaching out for help is a sign of weakness. That's a myth. That's baloney.
I agree.
The courage is saying, hey, I'm in over my head. I need some help. And you do what you got to do.
Absolutely. Strong people ask for help.
It's easy to say, let's talk about it. And you have been victimized. You're embarrassed about it. You haven't told a soul. You realize there's a problem. And you understand that the only way out of this cycle is to talk to someone. How do you take that step? What does that step look like from a victim's perspective to make that leap?
Well, I think the first thing is to understand that it's normal to have those feelings of guilt, shame, embarrassment. It's normal to ask those questions to yourself. Did I do something wrong here? Is this my fault? I think once a victim can understand that it's not your fault, maybe you didn't do anything wrong, and to know that you're not the only one that feels that, and that there is another side to whatever that experience is that you had suffered through.
So you realize that. How do you then make the leap to what does that conversation look like? What's the next step to actually talking to someone?
It's a courageous and bold step that victims take when they are willing to go seek outside help.
Okay.
It's not easy. That first step is probably the most pivotal step in this whole process.
So it's tough. There's no script to go off, having those uncomfortable conversations. So what do you just blurt it out? Do you just kind of give it in little bits until you can trust someone? What advice do you have?
It's a slow conversation that has to take place at the victim's pace.
Okay.
So an outside party can't force or rush a person to open up about their traumatic experience. Okay. I think it depends on who that person is talking to. Okay. If the person goes to someone that there's a relationship that's already been built and established and trust is there, maybe that person who the victim seek out for help can have a little more direct approach in the questioning, because you don't have to do all of the foundation laying. But if it's someone that I don't know, I think it's a slow process. A lot of times with victims, it's about safety. They don't feel safe enough to talk about their experience. So you have to take time to build that safety net, if you will. And simply going into, maybe it's a treatment facility, maybe it's a rape counselor, crisis intervention worker, and just showing up. If you're going to a professional establishment, the people there, the case manager, the clinicians, the psychiatrists, they're trained to where if you show up and allow them to walk you through the process that comes after that.
That's a good point. So understanding that you don't have to share the whole story at once, you can share a little bit just to the point that you're comfortable.
Absolutely.
You don't have to eat the whole elephant. You just take one bite at a time.
Absolutely.
Okay.
When it comes to trauma, most of the times it's a slow, long process.
Anything else with the victim cycle here?
that completes the victim
Okay,
cycle.
so I kind of see a theme that as you don't talk about it, as you keep it inside, the cycle goes round and round. You never get out of the cage, and it goes down, down, down. Whereas by taking these steps we've talked about, breaks you out of the cycle.
I think another big thing is that when you stay in the role of victim, statistics have shown like kids from grades 6 to 9 are 60% more likely to have a felony conviction as they get older. Not only that, but it costs billions of dollars for corporations when bullying happens in the workplace as well.
That's an amazing statistic. And the thing is, in my opinion, I want to see what you think, unprocessed trauma is the problem number one facing the human race. It's the biggest problem on the planet.
Absolutely, I would agree.
Okay, good. So we've kind of covered the victim cycle here, JC. Let's move over to the bully cycle. What's kind of the big picture here?
The big picture here is that many of, at least the kids that I work with, many of them have been traumatized themselves. And so they're trying to figure out how to manage that traumatization, and what it shows up as is bullying, inflicting hurt and harm on other people.
Okay, so these people, they could be adults, they could be kids.
Yeah.
They've been traumatized and they're expressing that or reacting to it by being a bully.
Yeah.
Okay.
And for them, I think in most cases, it relieves some of that pain that they're feeling. So we have this phrase that hurt people hurt people.
Okay.
You know, and that is so true when it comes to bullies. Hurt people hurt people.
Okay, so actually these are close cousins. Okay,
almost like identical twins.
Yeah, so the bullies are hurting inside themselves. They're expressing it in a very bad way, but they're, in a way they've been victims before. It doesn't excuse their bad behavior.
Not at all.
So let's get into the little bit of the detail. Where's this graphic kind of start, and what is it telling us?
Much like the same with the victim cycle, that if for those who have been victimized or those who are bullying, that they have to talk about that. They have to talk about, why am I inflicting this hurt and pain on other people?
And what do they say? I mean, that's kind of embarrassing to say, hey, I'm being a jerk.
And so the thing is, if they no longer want to participate in that behavior, is you're trying to get down to the why. Why do I do this? And oftentimes with the kids that I work with, their why is because they've been victimized by a parent or a brother in their own past.
So if I get this straight, if you're a bully, and you're hurting other people, you got to really go back to see where you were victimized, to see why you're acting out in this bad way.
Absolutely.
Am I missing that?
You got it spot on.
Okay. So what's kind of next here?
So here is if we stay on the cycle, this unprocessed trauma continues to feed the behavior. Because that trauma is unprocessed and it's unresolved, it can show up in many different ways. It can show up in drug abuse, substance use, victimizing and hurting other people.
Okay.
So it's that whole thing about unprocessed trauma.
Interesting. So what's the next step?
So the next step is for them to understand what's their triggers. Bullies also experience body sensations when they're triggered and activated. Generally, when something makes them uncomfortable, that's when they want to act out. When they feel this need to inflict or bully someone else, what's going on internally? What's going on emotionally? What are they thinking and feeling at that point that triggers them to want to hurt someone else?
Okay. So what's kind of next here?
That if they don't exit the cycle, these negative feelings continue to produce negative behaviors.
So they're going to keep bullying, and it's going to get worse until they're in big trouble.
Absolutely.
Okay.
With this unprocessed trauma, what happens is those who are inflicting trauma on other people, they're trying to figure out a way to deal with their negative emotions. A lot of them have low self-esteem, and so they're trying to make sense of their emotional kind of core and what to do with that.
Yeah. So the bully or the macho guy, anybody acting, kind of overly tough or, violent, is got unresolved trauma, and this is their way of processing it. And the cycle continues kind of down and down and down.
Yeah.
So what's the next thing?
Bullies can develop strategies that can help to alleviate the feelings. Still doesn't address the unprocessed trauma, but it helps to alleviate the feelings. So exercise, listening to music, drawing, reading a book, things like that.
Okay, got it. So they're trying to get their adrenaline rush, but in healthy ways.
Absolutely.
Okay, got it.
The next thing is, the more bullies bully, if you get that, the more bullies bully, the more they stay on this cycle. It feeds the negative behavior. It feeds the negative feelings.
Got it. Okay. So what's the next thing?
Here as well, just like with up here, you may have to seek some professional help.
Okay.
Depending on how long the trauma was going on and how long you had to live with it, how deeply embedded it is in you, that professional help may be the only way to kind of get that out.
Okay.
And for the bully, the end of this cycle could be really devastating. You know, it could end in death, prison, just really bad.
Really bad. Not a happy ending to this story if it's not processed. So how do we kind of break out of this cycle?
So to break out of the cycle is the bully needs to understand their own victimization, their own traumatization.
Okay.
Really, and understanding why. They have to be curious about, why do I do this? You know, why do I feel this way? So that's the first thing, is that they have to be curious about the why.
Okay, so they have to have a spark of recognition. What do they do with that initial awakening?
So being curious isn't enough. They have to have a desire to want to stop and change.
Okay.
You know, and that's a little bit hard to do by themselves, especially when I work with young people. They need that outside person to kind of come in and act in a role of a coach.
Okay.
To kind of help them change this negative, destructive behavior.
Okay. So where does it go from there?
So once you've identified that I do want to change, it's, what do I do? What steps do I take to change the behavior that I no longer want to engage in? You know, and it may take that coach or that mentor to help craft an action plan. Okay.
If you're being a bully, I mean, it takes a lot of courage to say, I need to break out of this. I'm hurting others. I'm hurting myself. I'm hurting everyone around me, you know, with this kind of behavior. It takes some emotional intelligence, really, to step up and say, hey, I got to have these difficult conversations. I'm not going to cure myself by myself. I've got to reach out. This is good stuff. What's kind of the next on the list?
So lastly, once that kid has that support network, that system around them, people have to be patient. Give it time. Give it time. This isn't going to change. The behavior isn't going to change overnight. And it may take, in my situation with the kids I work with, them falling down, going back, reverting back into old behaviors, but constantly give them that reinforcement, that encouragement that they can change the behavior.
Now, with your work, I mean, you're on the front lines with some of this, and you talk to bullies that are, you know, I mean, does this stuff really work?
It really works, but what makes it work is I'm consistent in how I show up and talk to my kids.
Okay.
You know,
but with that coaching, so I take it you're probably the person that they confide in sometimes.
A lot of times.
Okay. So as a coach, I'm just kind of curious, from the coach's side, what do you say to those kids that have opened up to you and say, hey, I got a problem with this?
I just flip it. You know, they do it to their peer group. I'm much bigger than all of the kids that I work with. And I say, how would you feel if I did what you're doing to you? And a lot of times they have this macho kind of, because I work with mostly males. And it's a whole different thing when you know that I am now the bully that could possibly bully you. And it's not a feeling that anyone likes.
Yeah.
You know, and they admit to that. I wouldn't like you doing that to me.
Right.
Then I tell them, why do you think this other kid that you're bullying would like you doing it to them?
So you're kind of teaching some empathy here.
Absolutely.
Okay.
Absolutely.
Gotcha. So what I'm kind of seeing here with the victim cycle is if you don't process that, if you keep it inside, it's a downward spiral. It leads to drug addiction, alcohol addiction, any kind of addiction.
Yeah.
Bad self-esteem, could even in extreme cases lead to suicide.
Absolutely.
Here it could lead to incarceration, being kicked out of school, you know, nobody wanting to hang out with you.
Absolutely.
I mean, you could be basically excluded from, you know, the tribe, the group, you know, whoever. I mean, bad consequences either way, but the common denominator is wake up, realize this is going on, and talk about it and seek some help.
Absolutely. And just to understand that unprocessed trauma impacts us all.
Yeah, sure does. Okay, anything else? This is a great graphic and a lot of meaning here. Anything else you want to mention?
Thank you for having me.
Thanks for coming, JC. You're the man. Okay, so great core IQ skill. Like it, share it, talk about it, and we'll see you on the next episode.